that. So
Yeah, you did. It's over
I know I
there.
want to talk to.
Well, this is the
We're
trouble, I
live.
never remember. We're live. Senate Health and Welfare is back. Here we are. Katie, thanks for being here.
You're welcome.
Why don't you walk us through the changes that have come back from the House?
Okay, Katie McLean, Office of Legislative Counsel, I will share my screen. I've left their changes highlighted, in this document, and you'll see there aren't too many changes. Let me just refresh your memory, this you've worked on, it feels like many months ago now.
Yeah.
But this was related to resources and information that should be shared with providers and the public with regard to Alzheimer's and other dementia-related disorders. So that is what the bill was about. You, in subsection B, this was language you added. This was information that would be disseminated as part of a public health outreach campaign to both providers and the public. And the House has added in this language at the beginning of subdivision B1 to the extent funds exist. Okay. And they didn't make any other changes in this language except recognizing that there were multiple codes, Medicare billing codes for Alzheimer's disease and other type of dementia, so codes plural.
Thank you, Alicia.
Where is that? That is on page 12 of line 12, page 2.
Wow, there it is. Yeah.
Where was the, to the extent that funds are,
That is subdivision B1 on page
B1.
1.
okay,
Do you see it right there? It's the
Yeah.
lead-in language.
I don't, I've got the report here.
Okay. So that would apply to all of subsection B. And then they added a new section 2. That on or after January 15th of 2025, the Department of Health shall provide a presentation to the House Committee on Human Services and Senate Committee on Health and Welfare describing the public health impact of rare diseases in Vermont and the department's role in addressing rare diseases statewide. There is a bill on the wall in Human Services that would create a task force or working group on rare diseases and individuals living with rare diseases in Vermont, resources available to them, gaps in services. The committee did not move forward with that bill, but they didn't want that population of individuals to not have their concerns looked into. So this was an attempt to continue kind of moving forward on looking into what services and gaps in services there are for individuals with rare diseases.
This is great. This is something I've been wanting to get to for a long time, so I'm glad they're doing that.
Okay, great.
It was gonna be on the top of my list next year.
Just a
If I get reelected.
Me too.
Those.
So you're gonna report that?
Yeah.
And then-
Yeah, it's easy.
Cool.
I mean,
Seems good.
Yeah,
won't be hard. Is there any question or comment or all those in favor? Good. Thank you, Katie.
You're welcome.
I think that ends our work.